My name is Dr. Maitri Raman, and I'm a gastroenterologist and physician nutrition specialist at the University of Calgary. I'm here to talk to you today about maintaining a healthy weight in IBD. So there was a lovely study conducted about 10 years ago now in patients admitted to Canadian hospitals. In over 1,000 patients, 45% of all patients were diagnosed as having either moderate or severe malnutrition. However, surprisingly, it was only recorded in the medical chart 1% of the time. So this indicates that there is a substantial difference between the actual prevalence of malnutrition and how frequently physicians are identifying it, particularly when admitted to hospital. Now, when you have inflammatory bowel diseases, the prevalence of malnutrition is actually substantially greater. Instead of 45%, between 75 to 90% of individuals are diagnosed as having malnutrition when admitted to hospital. And even in the healthy IBD outpatient who is not admitted to hospital, malnutrition can affect them 20 to 30% of the time. Now, it's important to recognize malnutrition because it is associated with an increased infection complication or infection risk. And this is compounded or magnified significantly, particularly if you are receiving either a biologic agent or are taking an immunosuppressive medication. And infections are increased of all kinds: pulmonary or lung infections, wound infections, urinary infections, amongst others. Having malnutrition also increases the length of stay or length of time that you may be admitted to hospital. And after being discharged from hospital, having malnutrition increases the risk of hospital readmission. If you've had a surgery, malnutrition can increase the risk of wound breakdown, leakage at the surgical site, bleeding from the surgical site, as well as end organ complications, particularly heart or lung failure. Now, when you were receiving a biologic agent like an anti-TNF agent, an example of this could be infliximab or adalimumab, having malnutrition decreases its effectiveness of these medications. So understanding and diagnosing malnutrition is important so you can rectify it and implement strategies to decrease the risks associated with it. Now, there are many reasons for why you may have malnutrition when you're diagnosed with inflammatory bowel disease. First, if you have symptoms such as nausea, vomiting, abdominal pain, bloating, cramping, diarrhea, all of these symptoms may impact your ability to eat adequate normal volumes of food because these may enhance or worsen your symptoms. So food avoidance or decreased food intake may make you feel better, and understandably, you would naturally gravitate to this route. However, persistent declines in oral intake can certainly decrease the amount of protein, calories, and nutrients and micronutrients that you are consuming, leading towards malnutrition. In addition, if you've had prior surgeries as a consequence of your disease, you may have lower limits of small intestine remaining. Remember that the small intestine is really important to help absorb both fluids, electrolytes, nutrients, as well as essentially the food that you're eating. So surgical resections or removal of bowel resulting in shorter bowel can also can result in malabsorption. If you have active inflammation, or if you have a stricture or a narrowing or a blockage in your bowel, all of these things can understandably provoke symptoms as well and also facilitate malabsorption. Being on certain medications, such as steroids, may impact calcium, phosphate, and zinc absorption. And being on certain medications can also interact with other nutrients, leading towards deficiencies. So there are many reasons as to why malnutrition may occur in the setting of inflammatory bowel disease.